presentation. In a slight change to what's billed, we now have the pleasure of inviting Professor Nora Colton. Professor Nora Colton is the founder-director of the world's only business school for healthcare. And she's going to be discussing the new health economy, navigating innovation, equity, and the future of care. If you'd like to give a big round of applause for Professor Nora Colton.
So thank you so much. It's a pleasure to be here and to be able to talk to you about the new health economy, which is, you'll find out more in a minute what I'm talking about, but it's the evolving kind of changes, the disruptions that we see in the healthcare system today. And it's very much at the center of the Global Business School for Health. When we set up the school, it was in 2021. We took our first class in 2022. And we wanted to reimagine healthcare, create a school, a business school, just focused on healthcare and health, because these are the important sectors. And of course, we need to think not just about health and healthcare. Traditionally, we've thought a lot about therapeutics. This is probably the most exciting sector you could be involved in today. It's also growing at an exponential rate. But it takes thinking differently about how we go about our jobs, how we think about the structure of health and healthcare, whether or not we just have an NHS long-term plan or we have a health system plan. These are all important things that we need to consider as we think about this evolving system. And just quickly, a little plug, I've got a book coming out in January called The New Health Economy with Rutledge, and I hope that you'll take the time to consider reading it. All right. I'm struggling here to change my slides. I'm not sure what I'm doing. Okay. So let me do a little scene setting to just get started. As we all know, healthcare is evolving. If we think about the 1970s, the 1980s, for those of you in the room who may have been involved in the sector, it was all about Sigma 6, lean thinking, efficiency, okay, keeping costs down. Then as we moved into the 1990s, 2000s, particularly after the global financial crisis, we saw a real transition. It was all about restructuring, cost containment. That word, is a 90s term really in thinking about how we have to downsize and what that means in the workplace. And the NHS has been no exception. It has felt this very significantly. And also, part of that has been the lack of capital investment, real foresight about what it needs to look like, much more thinking in the moment and not thinking forward. And that caught us off, as we all know, when COVID hit. But it also provided an opportunity to do things that we had not considered in the health sector before. And that was really thinking about how we could use technology. We were forced to use technology, but when we used it, we realized what an opportunity. However, I would say we see a lot of organizations today spending a lot of money on AI, kit, technology, IT, and they're not getting the productive gains that they want. And that's partly because we have a productivity paradox. It's not just about spending more, it's about also creating the environment. If you take and you place, AI and digital platforms on top of old structures, you just get old structures that break faster. You don't actually get improvements. So we're now going into a period, I think, where we can start to think about how do we want to design our health system? What kind of leadership, management, training do we need around that? So I think these are well rehearsed, but I'm just going to mention them one more time. Some of these shifts that are driving the new health economy are AI and technology. And as I just said, lots of companies are putting lots of money in a study. It was shown that 70% of these technologies and AI solutions are actually not creating productivity. So there's lots of work that we need to do. We also know that whether we call them patients, consumers, clients, people are thinking differently, and their expectations have changed. They don't want to wait in a waiting room. They want to have the service they want. They want it when they want it, not when we want to deliver it. So those consumer expectations are putting a tremendous amount of pressure on our health systems in the NHS. And then, of course, I think we all recognize that we need to move from illness care to wellness care. And then in the UK, we've already started into that demographic decline. We're seeing fewer youth, more aging population, and that's going to have to shift our whole mindset about how we offer care. So these are all important issues to think about. So this is what the new health economy then looks like. It's made out of three interdependent sectors. We have traditionally thought about the healthcare economy. That's where the NHS sits, our hospitals, our private hospitals, our inpatient care. And that, of course, has been very important to how we have offered care here in the UK, particularly our universal health system is really the healthcare economy. But what is happening in the market is very important. And if we don't bring them all together, they will remain fragmented. And we will not get the synergy that we need to get from this new health economy. And that is the industrial health economy. We hear a lot today. You pick up any newspaper, there's an article about biotech. There's genomics, personalized medicine. All of these things are very important to how we're going to deliver care. But we've got to be working together in a more systemic way. And then last but not least is this service and support economy and sector, which is really our digital health, our wearables, our retail offers. I have seen over the last year lots of longevity centers, different kinds of clinics, different kind of testing being offered in the market. How does that fit into our thinking when we think about the NHS? We have to stop just thinking about the private sector sitting over here. We have to understand what's its impact on the public sector. How does it affect the health that we offer? So here's an example. Just look at this slide and see the magnitude of the shift. You can see how we've gone from traditional medicine and what this new health economy has to offer. And of course, value is going to be very important. We are not going to be able to bring costs down in healthcare because the need is growing, the demand is growing, and it's about keeping the supply up and also trying to create savings. That's where we need to be aiming. We need to be realistic about the ask as we go forward. And I think one of the most important stats on here is that global healthcare today makes up $10 trillion. That's the market value currently. And this, when you add in the new health economy, which again is growing very quickly, and areas like digital health, preventative health care, they're just at the nascent. They're just starting. And they will be tremendously important to this. And their contribution to GDP will continue to increase. The other thing is, and I've mentioned it already, but I want to really emphasize, the NHS is not failing, okay? But people's expectations are changing. What we want out of our health service is not what we wanted out of our health service in 1948. we are an aging population, so the services that we'll want are different. So we have to start thinking much more about system redesign, creating something that looks very different, rather than trying to just continually tack on to the same system, because consumer expectations are moving. Most people are very much in favor of the NHS, but they feel dissatisfied because it's not in line with these other two economies, the growth in the industrial economy, the service and wellness economy, where they get a different kind of attitude and a different kind of service in a different kind of timeline. And this is important. So what we need to be doing, and of course we hear a lot today about value-based care. And I am a big proponent, and in our school we do a lot around value-based care, because it is, as I said, we need to stop thinking about trying to save money. We need to start to focus much more on how are we getting value for money? How are we driving outcomes that patients actually want? And we need to be taking a much more patient-centric approach. And this is going to be very important to get that alignment, and get that alignment through our financing, our governance, and our delivery. And that's where the opportunity lies. And also in terms of thinking about automation and AI. And this is a really important and growing area. We're not short of data. Healthcare has more data today than ever before. And much of value-based healthcare and being able to understand a value hinges on using that data correctly and really harnessing that data. But again, we've got to have much more education, training. We've got to think about how we are going to approach that. So what is the Baumol curve? Well, Baumol wrote a book called The Cost Disease. And he claimed that education and healthcare were two sectors that could not be automated or have the same kind of economies of scale found in other industries. But generative AI is changing all of that. So again, we have to understand what roles that's going to play in the future of our healthcare. But more importantly, we're in a caring industry, so we need to make sure that we don't just understand the tech side, but how to keep the human in the loop. How do we maintain our values within that? And lastly, I just want to mention big tech, because this is the blind side for healthcare. These organizations are investing more and more. You know, if you had told me 10 years ago that Amazon was going to be a key player in the future of healthcare, or even Apple, I would have been reluctant to believe that. But they very much have their sights on healthcare. And this is something that, as leaders, managers, we've got to do that horizon scanning. We've got to figure out, how do we bring them in? We should be shaping the health system. If we are constantly reacting to technological change, if we're reacting to the consumerization of healthcare rather than shaping that, then these companies will be the people shaping the future of healthcare. And it's so important that we own that as we move forward. They see a real opportunity here, and they're coming in a way that doesn't hit the same barriers that we see as we go forward. So lastly, we and the NHS are very integral to making sure that we have equity. But we also have to think about, how do we ensure that we're bringing everyone along? Technology is an important tool that we will use as we go forward. It is just that, a tool, and we have to be the shapers. We need to make sure that the timing is right. We need to make sure that digital literacy at all levels within our communities is moving at the same pace. And it's the same thing with our staff. When we think about our workforce, one of the biggest lessons I've learned through doing research, looking at automation and AI and how it impacts healthcare professionals, is that we're not necessarily bringing our clinicians with us. They often feel that they are having things imposed on them, that they're not getting the agency that they need. And these are the people that are critical to our health system. And that's where governance, the structure, we need to start with that, not in with that. It's not about adopting the technology and then putting the governance in place. So these are all important aspects as we think about the new health economy. There are many opportunities for the NHS. There are ways that we could shape it. But if we ignore parts, bits, pieces, if we do not take a much more holistic approach of thinking about what is shaping healthcare, we will be shaped rather than be the shapers. Thank you.
Thank you so much, Nora. And I would say that the school has done a lot, is a sponsor for today. And can I quickly announce that we have some